Hi, my name is Aiden Garcia, and I chose to focus my research on the barriers to cervical cancer screening tests, specifically on the access to public health services and the role it plays in obtaining cervical cancer screening tests. My research question was, in female adults, does access to public health care as opposed to no access to public health care increase rates of cervical cancer screenings? So basically the purpose of this research is to identify whether access to public health services plays a role in obtaining cervical cancer screenings. To be specific, access to public health care includes aspects related to the availability of clinics with access to cervical cancer screening tests, the ability of patients to access health care with regards to insurance and financial means, the ability of patients to travel to and from public health care facilities, education on where and how to access clinics, facilities, and other resources in which cervical cancer screening tests are performed. So what are cervical cancer screenings? These types of screenings include both a pap smear and a vaginal exam. The vaginal exam will allow for visualization of the reproductive structures, while the pap smear will allow for the detection of abnormalities of the cells at these structures. Cervical cancer and the lack of screenings for this type of cancer is an important issue because this type of cancer is the fourth most frequent cancer among women. And screening can lead to early detection and thus early treatment. And by not having this screening, we are decreasing the rate at which cervical cancer is being caught. So it's important to know that the rates of cervical cancer have declined significantly in the United States as the rates of cervical cancer screenings have increased. However, there is still a large part of the population that does not obtain screening for this type of cancer. Factors such as cost, availability of locations offering screenings, and ability to access these facilities all play a role in the public health access of cervical cancer screenings. Some women lack insurance coverage or financial means to pay for cervical cancer screenings and treatments. Additionally, women may not have access to public health, meaning there's no facility or clinic in the area, or no transportation to and from these facilities to have testing done. These barriers are a significant problem because they hinder female adults from early identification of cervical cancer. As I said before, early identification of cervical cancer can help in treatment and prevention, but it has many other benefits, including early treatment, vaccination as a means of prevention of more serious issues like infertility, and increased rates of survival among those diagnosed with early signs of cervical cancer. So the first study that I used in my research was cervical cancer screening barriers and risk factor knowledge among uninsured women. In this study, 433 women of low income status were surveyed during grant-funded cervical cancer screenings. The goal was to identify the knowledge of risks associated with cervical cancer as well as other factors preventing these women from obtaining screening tests. Some of the factors assessed included lack of access to healthcare insurance, fear or embarrassment of diagnosis, educational level, language barriers, lack of transportation or care, and anticipated pain. The results of this study showed that most common barriers among women of this population included cost and lack of knowledge of the procedure. It was shown that 61.6% of the individuals in this study identified cost as the number one barrier to obtaining cervical cancer screening or pap smears. A major factor that strengthened the results of this article was the subdivision of different ethnicities and races when comparing their responses to the knowledge-based and self-reported survey. Some of the limitations of the study included a small sample size in remote geographical regions, Austin and Houston, Texas, in which this study took place. The second study that I used to supplement my research was the motivation and barriers to cervical cancer screening among HIV-infected women in HIV care, a qualitative study. 18 HIV-positive women in Uganda were provided questionnaires on the general understanding and risks for cervical cancer, as well as the barriers to obtaining cervical cancer screening tests. The questionnaire included factors like risk perception, availability, and access to information on cervical care and related services, facility factors, motivation, and previous screening experiences in some groups. The main purpose was to determine why screening services were not being utilized despite open availability during all HIV services. So these women were actively being treated and assessed, monitored, had checkups and things, and had the opportunity to utilize cervical cancer screening tests during this time. And the levels were showing that these screenings were not being as utilized as much as the treatment and care for HIV. The study showed that most women in this population did not obtain testing due to misunderstandings or fear about the testing procedures, lack of access to education on testing, and inability to attend the facility. The lack of numerical data is based on the fact that this was a qualitative study and focused on the informational responses of the women to these questions. There were several quotations noted in this study that gave information showing that lack of access in relation to transportation or a nearby facility as being a major barrier to obtaining not only cervical cancer screening but also the care they were provided for their HIV. Some of the strengths of this study were that it displayed a qualitative narrative that used direct quotes from participant interviews and showed definite data that came directly from the study participants. Some of the limitations of the study included the sample size, which was limited in both numbers and cultural groups. They were all from the same area in Uganda, and there was only 18 of them who participated in the study. The last study that I used in my research was the perceived benefits and barriers of cervical cancer screening among Chinese American women. 121 Chinese American women ranging in age from 21 to 65 were recruited using the snowball sampling technique and given a questionnaire aimed towards collecting perceived barriers and benefits of cervical cancer testing. This questionnaire was distributed by mail to a list of individuals collected from individuals who had already taken the test or who had been collected by the researchers as they went door to door. The results of this study showed that the major hindrances for obtaining cervical cancer screening tests were reluctance about cost, lack of access to care, preference of use of Chinese medicine as treatment rather than Western medicine. Two of the really significant data points that I pulled from this research study were the answer for the expense of the procedure being too high as a barrier was at a p-value of 0.0008, less than 0.0008. And not having access to a healthcare facility as a barrier was less than 0.0001. These were significant data points, and they showed that these two answers for the study were more common among the population than were other answers to questions on the survey. The strength of the article provided, the strengths within this article were that they provided research-based data supporting culturally and age-related nursing implications for screening tests. And they also displayed the results of the study in a very easy to navigate way. Some of the limitations included the small geographic region for more participants were chosen, as well as the lack of data collection on where participants were born, generation related to immigration, additional risk factors for cervical cancer, education level, and socioeconomic status. So in conclusion, the lack of access to public health services and screenings can play a role in hindering women from identifying cervical cancer and leading to increased rates of this disease within the community. Location cost and insurance coverage are major barriers related to public health care access that can have an effect on women and their motivation to be tested. Greater access to cervical cancer screenings can lead to decreased rates of manifestation of cervical cancer and increase the public's ability to manage and treat the disease. The application of the study into the nursing practice is diverse and in many ways encompasses the core ideals of the nursing practice. In understanding the barriers displayed in this research, it will allow for better assessment and identification of barriers not only to cervical cancer screenings, but other screenings and overall care, other types of screenings and overall care. Additionally, this research shows how important it is to educate the patient on how and what will take place when procedures are performed, how important screening tests and early identification is, and what to expect from a positive or negative test. This research review also informs nursing care in the way that it shows how important identifying barriers may be to overall access and availability of care, and may also inform nursing care by reinforcing the importance of understanding cultural influence on certain procedures, like with the group of Chinese women who showed a desire to use traditional medicine, or like in the women in Uganda, there may be some cultural differences such as wife seclusion that may be keeping them from accessing certain types of care. Oh, and this was the slide I meant to be on. Some nursing leadership considerations. So the findings of the study review can relate to nursing research in the way that nursing leaders may see the needs of these certain populations and choose to intervene. One example that I found within my research was there was a group of DNP students who saw the need for cervical cancer screening tests in their area and put on a cervical cancer screening clinic for free so that the need of the community would be reduced. Additionally, this information may be used or reviewed by nursing managers, unit managers, and other nurse leaders to educate nursing staff about the barriers to public health that may be affecting the provision of care and screenings for cervical cancer, as well as overall screenings and obtaining care in the community. Additionally, the research found in this review informs the practice of nursing by allowing nurses to widen cultural competence and understanding of the types of barriers that hinder care. And these are my references.